You're thirsty all the time. You drink water constantly. You drink it when you wake up. You drink it throughout the day. You drink it before bed. And yet, your mouth is still dry. Your lips are parched. Your throat is dry. Or you're exhausted. You wake up tired. You're tired during the day. Afternoon hits, and you can barely keep your eyes open. You thought this was just aging. You thought this was normal. But the exhaustion is relentless. Or you notice your vision is getting blurry. You're having trouble focusing. You thought you needed new glasses. You went to the eye doctor, but the new prescription didn't help much. Or you're experiencing painful tingling in your feet, numbness in your toes. Sometimes pain shoots through your legs. You assumed it was arthritis. You assumed it was just aging. You're not just aging. You probably have diabetes, and you probably don't even know it. My name is Dr. David Miller. I've been practicing medicine for over 25 years, and one of the most common, most serious, and most preventable conditions I see in my older patients is type 2 diabetes. The tragedy is that most people don't know they have it until serious damage has already occurred. Diabetes is an epidemic. 1 in 3 adults over 65 has diabetes. That's 33% of the oldest population. 1 in 3. And nearly half of older adults have prediabetes. These are blood sugar levels that are elevated but not yet in the diabetes range. Prediabetes is actually more common than diabetes. Most people with prediabetes don't know they have it. And here's what devastates me. Most of this is preventable. Prediabetes can be reversed. Early diabetes can be controlled. But prevention is vastly easier than treatment. Let me explain what's happening when you have diabetes. Glucose is your body's primary source of energy. When you eat carbohydrates, your body breaks them down into glucose. That glucose enters your bloodstream, and your pancreas releases insulin. Insulin is a hormone that acts like a key. It allows glucose to enter cells. Once glucose is inside cells, it's used for energy. But when you have diabetes, this system breaks down. In type 2 diabetes, your cells become resistant to insulin. Insulin is knocking on the door, but the cells aren't opening. The glucose can't get in. So glucose accumulates in your bloodstream. Your blood sugar rises. And because cells aren't getting the glucose they need for energy, you feel exhausted. Your pancreas senses the rising blood sugar and makes more insulin. It tries harder. It produces more and more insulin. But the cells still aren't responding. This continues for years. Your pancreas is working overtime, and gradually it gets exhausted. It can't produce enough insulin anymore. Your blood sugar spirals out of control. This is type 2 diabetes, and it develops silently. You don't feel it happening. You don't notice it. For years, your body is being damaged by elevated blood sugar. Your blood vessels are being damaged. Your nerves are being damaged. Your kidneys are being damaged. Your eyes are being damaged. And you have no idea. This is why screening is so critical. The American Diabetes Association recommends screening for diabetes every 1 to 3 years for all adults over 45. If you have risk factors, overweight, family history, sedentary lifestyle, high blood pressure, you should be screened more frequently. A simple blood test, either a fasting glucose test or an A1C test, can detect diabetes or prediabetes. If you're over 60, you should absolutely know whether you have prediabetes or diabetes. Let me tell you about one of my patients, Michael. Michael was 68 when he came to see me. He hadn't been to a doctor in years. He felt fine. He had no complaints. He exercised occasionally. He ate what he thought was a healthy diet. I recommended screening. Michael was reluctant. He said he felt fine. Why would he have diabetes? But he agreed to the blood test. The results shocked him. His A1C, a measure of average blood sugar over the past 3 months, was 8.2%. That's firmly in the diabetes range. Michael had type 2 diabetes, and he had no idea. I asked Michael how he was feeling, and then he thought about it. He said, "Now that you mention it, I have been tired, and I have been thirsty, but I thought that was just getting older." Michael's story is tragic because it's so common. Most people with diabetes don't know they have it, and the longer it goes undiagnosed and untreated, the more damage occurs. Now let me explain what happens when diabetes goes untreated. High blood sugar causes damage throughout your body. First, it damages blood vessels. Elevated glucose causes oxidative stress and inflammation. Small blood vessels are particularly vulnerable. This is why diabetes causes problems with vision. High blood sugar damages the tiny blood vessels in your eyes. Over time, this can lead to blindness. Diabetes also damages the blood vessels in your kidneys. The kidneys filter waste from your blood. If those blood vessels are damaged, your kidneys can't function properly. Eventually, your kidneys fail. You need dialysis. You're hooked up to a machine 3 times a week for the rest of your life, filtering your blood. Diabetes damages nerves. High blood sugar damages the protective coating on nerves. This causes diabetic neuropathy, nerve damage that causes pain, tingling, and numbness, particularly in the feet and legs. Many people with diabetes eventually lose feeling in their feet, and because they can't feel pain, they don't notice injuries. A small cut becomes infected. The infection spreads, and the result is amputation. Diabetes damages your heart and blood vessels. It accelerates atherosclerosis, the buildup of plaque in blood vessels. People with diabetes have much higher rates of heart attack and stroke. But here's the good news. Most of this is preventable. If you catch diabetes early, or better yet, if you catch prediabetes before it becomes diabetes, you can prevent these complications. You can actually reverse prediabetes. You can control diabetes. You can maintain your health and your independence. The key is lifestyle change. Diet, exercise, and weight loss are the most powerful interventions. They're more powerful than any medication. The research is clear. In a massive study called the Diabetes Prevention Program, researchers followed people with prediabetes. Half received intensive lifestyle intervention, counseling on diet and exercise, with a goal of losing 5 to 7% of body weight. The other half received standard care. After 4 years, those who received the lifestyle intervention had a 71% reduction in the development of diabetes. 71%. That means most people who were heading toward diabetes avoided it altogether. They stayed healthy. For people over 60, the results were even better. Lifestyle intervention was more effective in older adults than in younger adults. This means if you're over 60 and you have prediabetes, you have an excellent chance of reversing it with lifestyle changes. Let me talk about diet. The approach that works best for managing blood sugar is to eat foods that don't cause dramatic spikes in blood glucose. This means minimizing refined carbohydrates and sugar. It means eating whole grains instead of white bread and white rice. It means eating vegetables, lean protein, and healthy fats. The specific distribution matters. Instead of eating a large bowl of pasta or a giant bagel at one meal, eat moderate amounts of carbohydrate distributed across your meals. Aim for about 45 grams of carbohydrate per meal. This prevents large blood sugar spikes. Non-starchy vegetables are your friend. Broccoli, leafy greens, zucchini, peppers, cauliflower. These are low in carbohydrates, high in fiber, and packed with nutrients. Fill half your plate with non-starchy vegetables. Fill 1/4 with lean protein, and fill 1/4 with whole grains or starchy vegetables. Lean protein is important. It slows down the absorption of carbohydrates, preventing blood sugar spikes. Eat fish, poultry, eggs, beans, lentils. Fatty fish like salmon are especially beneficial because they contain omega-3 fatty acids, which reduce inflammation and protect your heart. Avoid sugary drinks. This is huge. Sugary drinks cause massive blood sugar spikes. They're liquid sugar. If you drink soda, juice, sweet tea, or sugary coffee drinks, stop. These are destroying your blood sugar control. Switch to water, unsweetened tea, or black coffee. Now let me talk about exercise. Exercise is incredibly powerful for managing blood sugar. When you exercise, your muscles use glucose for energy. Your blood sugar drops. Your insulin sensitivity improves. You become less diabetic. The research is clear. In the Diabetes Prevention Program, people who exercised regularly and lost weight reversed their prediabetes, even without medication. Aim for 150 minutes of moderate aerobic activity per week. That's about 30 minutes, 5 days a week. This can be brisk walking, cycling, swimming, dancing, anything that gets your heart rate up. Also include resistance training twice a week. Resistance training builds muscle, and muscle is metabolically active. It burns glucose. The more muscle you have, the better your blood sugar control. And here's something important. Sedentary behavior is toxic for blood sugar control. Don't sit for more than 2 hours at a time. Get up, walk around, move. This simple habit can dramatically improve your blood sugar. Weight loss is critical if you're overweight. Excess weight makes your body more insulin resistant. Losing just 5 to 7% of body weight significantly improves insulin sensitivity. If you weigh 200 pounds and lose 10 to 14 pounds, you'll see a dramatic improvement in your blood sugar. Let me tell you about another patient, Linda. Linda was 62 when I diagnosed her with prediabetes. Her fasting glucose was 110. Her A1C was 5.9. She was on the verge of becoming diabetic. Linda asked me what she needed to do. I told her that she had a choice. She could take medication. Metformin is a drug that helps control blood sugar. It's safe and effective. But lifestyle change was more powerful. Linda decided to commit to lifestyle change. She started walking 40 minutes a day. She changed her diet, cutting out sugary drinks, eating more vegetables, reducing refined carbohydrates. She lost 15 pounds over 6 months. 1 year later, Linda had her blood sugar rechecked. Her fasting glucose was 95. Her A1C was 5.4. Linda had reversed her prediabetes. She was no longer prediabetic. She was back in the normal range. Linda did this without medication. She did it through diet, exercise, and weight loss. And she probably added years to her life. She probably prevented kidney disease, heart disease, blindness, and neuropathy. Now, not everyone can reverse prediabetes with lifestyle change alone. Some people have advanced prediabetes or early diabetes where medication is needed. If you're in this category, don't be discouraged. Medication combined with lifestyle change is very effective. The most commonly used medication for type 2 diabetes is metformin. Metformin works by reducing the amount of glucose your liver produces. It has been used for decades. It's safe. It has relatively few side effects. And it's inexpensive. Other medications work through different mechanisms. Some stimulate the pancreas to produce more insulin. Some increase insulin sensitivity. Some help your kidneys excrete more glucose in urine. Your doctor can recommend what's best for you. But medication should be combined with lifestyle change. Medication alone is not enough. You need to address the underlying problem, insulin resistance, through diet, exercise, and weight loss. Let me also talk about complication screening. If you have diabetes, complication screening is essential. You need yearly eye exams, specifically dilated retinal exams to check for diabetic retinopathy. You need yearly foot exams. A podiatrist or your doctor should examine your feet carefully, checking for neuropathy, ulcers, and other problems. You need yearly kidney function tests. Diabetes damages kidneys. Early detection of kidney damage allows intervention before it progresses to kidney failure. You need to check your blood pressure regularly. Diabetes, combined with high blood pressure, exponentially increases your risk of heart attack and stroke. Controlling blood pressure is critical. You need regular cholesterol checks. Diabetes increases cholesterol, particularly the bad kind. Statins, cholesterol-lowering medications, are often recommended for people with diabetes. And here's something important: cognitive screening. Diabetes increases the risk of dementia. If you have diabetes, your risk of cognitive decline is higher. Staying cognitively active, exercising, managing blood sugar well, and maintaining social connections all help protect your brain. Let me tell you about another patient, Robert. Robert was 75 when he was diagnosed with type 2 diabetes. His blood sugar was very high. His A1C was 9.2%. He had likely had diabetes for years without knowing it. Robert already had complications. He had some kidney damage. He had early signs of diabetic retinopathy. His blood pressure was elevated. I started Robert on medication, but I also counseled him extensively on lifestyle change. Robert was motivated. He understood that the choices he made now would determine whether he went blind, whether his kidneys failed, whether he had a heart attack or stroke. Robert committed. He changed his diet. He started exercising. He lost 20 pounds over 1 year. His A1C improved from 9.2 to 7.1%. Still not perfect, but dramatically better. More importantly, his kidney function stabilized. His eye problems didn't progress. His blood pressure improved. Robert is still healthy. He's maintained his independence. He's still active and engaged in life. But here's what breaks my heart. If Robert had been screened 10 years earlier, when he had prediabetes, he could have prevented all of this. He could have reversed his prediabetes. He could have avoided diabetes entirely. He could have avoided the complications. His life would have been very different. Don't be Robert. Don't wait until you have complications. Don't wait until diabetes is advanced. Get screened now. If you're over 60, Make sure you know your blood sugar status. If you have prediabetes, take aggressive action. Lifestyle change works. It's not too late. Here's my challenge to you. First, if you haven't had your blood sugar checked in the past year, schedule a doctor's appointment and ask for screening. A simple fasting glucose test or A1C test can tell you if you have diabetes or prediabetes. Second, if you're overweight, start losing weight. Even 10 to 15 pounds can have a dramatic effect on insulin sensitivity. Third, start moving. Aim for 30 minutes of exercise, 5 days a week. It doesn't have to be intense. A brisk walk counts. Fourth, change your diet. Cut out sugary drinks. Replace refined grains with whole grains. Fill half your plate with vegetables. Include lean protein at every meal. Fifth, check your stress levels and sleep. Stress and poor sleep worsen blood sugar control. Prioritize stress management and good sleep hygiene. These changes aren't complicated. They aren't expensive, but they could literally save your life. They could prevent blindness, kidney failure, amputation, and heart disease. Diabetes is preventable. Prediabetes is reversible. But only if you take action. Only if you get screened. Only if you make the lifestyle changes. The power is in your hands. In my next video, I'm going to reveal a nutrient that almost every older adult is deficient in, and why that deficiency is probably causing damage to your body right now. You've probably never heard of it, but it could be the most important video you watch all year. Subscribe so you don't miss it. This video is for educational and informational purposes only and is not intended as medical advice. Diabetes is a serious medical condition that requires professional diagnosis and management. Always consult with a qualified healthcare provider before making significant changes to your diet, starting an exercise program, or if you suspect you may have diabetes. Regular screening and professional medical care are essential for prevention and management of diabetes and its complications.